Welcome back to Hey Doc with me, Dr. Kady. This is part 5 in our series about common mistakes that women make when trying to fall pregnant naturally. So in this episode, we'll be looking at male factors. Gone are the days where we attribute infertility to just being a woman's issue. We now know so much more about infertility, and when it's a problem, we also look to the male partner and we ensure that we're not overlooking any pathologies that could be coming from the male counterpart. So in this video, we're going to go through a list of the things that could be a problem with your partner. And after this video, you and your partner may be wanting to do further investigations and not just limit yourself to doing a sperm count. Let's just say that a sperm count is a starting point. It gives us a good indication that there may be something wrong and that you want to be doing further investigations. So you can go through this video and just make sure that once you've had your consultation with your fertility specialist, all of these issues and pathologies that I'm going to talk about in this videos have been ticked off and that all is well with regards to these different areas for your partner. Let's dive into it. Male infertility causes can be divided into physical factors, lifestyle and environmental factors, health and general medical conditions, and finally into genetic causes. So let's go through the list of the physical factors. The first pathology that could lead to male infertility is a condition known as varicocele. In this condition, there are enlarged and engorged veins that are found in the scrotal area of the man. These veins cause an increase in testicular temperature, thereby reducing the production of sperm cells. Infections, STDs, as well as infections such as epididymitis, infection of the prostate gland, or any other form of infection in the male's genital area leads to infertility by the mere fact that these infections lead to scarring, and scarring will obstruct the passage of sperm cells. Believe it or not, there is a condition known as retrograde ejaculation. Yes, ejaculation issues do exist and can lead to infertility. The ejaculation issue that specifically leads to infertility is retrograde ejaculation. And simply what that means is that instead of the sperm and the semen actually coming out from the penis, when the man ejaculates, it goes back and leaks into the bladder. Cancers, whether benign or malignant, can lead to infertility by causing hormonal imbalance. Cancers will lead to infertility because they will reduce the production of sperm cells. So if you have been experiencing infertility, one of the very simple things that you can do yourself or you can help your partner to do, not that it will identify all forms of cancers in the male reproductive system, but it certainly is something very easy that you can do yourself, is to feel the testicles as well as the spermatic cords behind the testicles. If you feel a hard, craggy or irregular type of lump, if it's particularly painful, if you feel something on the one side that isn't present on the other side, if there is significant swelling in the testicle and it just looks discolored, those are the very simple things that you can do to possibly help you identify a cancer in the male reproductive organ early. And just as there are uterine congenital defects, spermatic duct defects also exist. With this condition, defects in the spermatic duct means that although semen does come out when the man is ejaculating, the semen doesn't contain any sperm cells. And this spermatic duct defect often leads to blockage, meaning that sperm cells do not enter the semen in the first place. Now, onto lifestyle factors. Drug use. in particular illegal drugs, recreational drugs. Also, guys, anabolic steroids are also considered bad when it comes to sperm count. These recreational drugs, these anabolic steroids, they lead to infertility because they impair the sperm cell function. So you may be producing sperm cells just fine, but actually you end up with a greater percentage of sperm cells with abnormal morphology. The sperm cells do not have a good mobile or good motility. And when you use these type of drugs, you are basically producing poor quality sperm. And in some cases, depending on which type of drugs that you are using, you may actually be impairing the production of sperm cells in the first place, because some of these drugs cause hormonal imbalances. Then we have alcohol use, tobacco smoking. These both lower your testosterone levels and ultimately lead to erectile dysfunction, but they also lead to low sperm count and reduce sperm cells motility. Excessive weight gain, obesity, as well as chronic stress over a long period of time. These both will lead to an increase in the production of stress hormones like cortisol, which is what will happen when stress goes on for a long period of time. High level of cortisol over a long period of time, which is what is seen in chronic stress, will lead to an impairment of the hormones that are needed for the production of sperm cells. So being overweight and the male partner being stressed over a long period of time will lead to low sperm count. Heat is an absolute no-no. Your testicles do not tolerate high temperature in your scrotal area. The source of high temperatures comes from saunas, hot tubs, and wearing tight clothes that leads to the testicles being held closer to the body, and that will increase the temperature in the scrotum. And what that will lead to is a significant slowdown in the production of sperm cells. And when men expose their scrotal areas to these high temperatures frequently by wearing tight trousers, tight underwears frequently, these men will have lower sperm counts. Let's move on to talking about health and medical conditions. Conditions like diabetes, autoimmune pathologies like thyroid disease, rheumatoid arthritis, amongst many other medical conditions, can all lead to infertility in men. So if you've been trying to conceive, what would be a good idea is, as well as the woman going to have routine screen, routine bloods, it wouldn't be such a bad idea for both you and your husband to do these routine bloods together. And among some of the things that your doctor should be requesting whilst doing these routine screen is to check for your thyroid and definitely for diabetes. Being on certain medications also doesn't help, as they impair the production of sperm cells. So classically, medications for high blood pressure, antidepressants, as well as chemotherapies, which are used to treat cancers, are all medications that will classically impair sperm cell production and lead to a low sperm count. Let's not also forget men who have had previous injuries or traumas to their testicles. These men are more likely to experience infertility after trauma happening to the testicles. Finally, we look at genetic factors. Y chromosome microdeletions. This condition is rather complex and maybe too in-depth, but suffice to say, for the purpose of this video, is that there are small deletions that happen along the Y chromosome, and men who have these microdeletions will have a reduced ability to produce sperm cells. The most common genetic condition to cause infertility is cystic fibrosis. This leads to the absence of the vas deferens and will prevent sperm cells from mixing with semen. That's it for this video. We have reached the end of the series of common mistakes that women make when trying to conceive naturally. I truly hope that the series has been helpful and has given you insight into all of the things that you need to consider and address whilst you are actively trying to fall pregnant naturally. Thank you so much for watching. I will leave a link to the other parts in the description box. Take care, and before you leave, you know what to do. Smash the like button and do support us by subscribing. We look forward to seeing you in our next video, and until then, don't miss us too much, because you can always watch all of the many videos that we have here on this channel on women's health and fertility medicine. Take care, and we will see you later.